Mistletoe treatment right after surgery in pancreatic cancer. Some new research out of Korea. Hi there, my name is Dr. Walter Lemo, naturopathic physician with a practice solely focused in cancer care for over 20 years. There was a retrospective paper published from Korea where they were administering mistletoe treatment. So they had surgery, and then right after they began mistletoe treatment on them, a series of injections. And then this stopped as soon as chemotherapy was going to begin. And what they did is they just analyzed the data. And they found that those who were diagnosed with more earlier stage pancreatic cancer could have had a survival advantage, meaning they lived longer. And so they noticed that, and one of the things that they discussed is that, hey, perhaps in groups of patients where there's poor tolerance to chemotherapy, that mistletoe should be the treatment used more for them. They noticed that, that most chemotherapy regimens had their survival advantage versus when they started to add in FOLFIRINOX, which is the new standard, it didn't hurt, but it didn't help. And then paradoxically, though, they also noticed that those with more advanced pancreatic cancer, the mistletoe treatment kind of paradoxically, it didn't help them and it may have hurt them. So what's really interesting for me is that you're seeing this research conducted by their hepatobiliary pancreatic cancer centers in Korea. Korea is definitely what we've learned from them is that they're a progressive country, and when there's new ideas, they just go for it. Something here that in Canada they can definitely learn from, and so to gather information to better help their citizens. So anyways, obviously more information to come, but here you see Korea, exploring the use of mistletoe treatment right after surgery. And we know that, for example, surgeries, they're immune suppressive. There's the microenvironment more pro-inflammatory that helps to immunomodulate. So it's been used in other kinds of cancer situations like that. We use that similarly for other cancers. And obviously we don't know what would happen if mistletoe treatment was used longer, like throughout chemotherapy. So that's where, we have more experience using it in those ways. But nonetheless, it's interesting information and new information for me, and on how these progressive pancreatic cancer hepatobiliary surgical units are exploring the use of mistletoe in pancreatic cancer.